Constipation is common, but sometimes it's your body waving a red flag. The tricky part is that the warning signs aren't always dramatic. You might still be passing stool, but something about the pattern, the pain, or the timing feels off. This is about spotting those moments when wait and see can become check in with a clinician. A useful way to think about it is change plus impact. Has your normal routine changed in a way that's persistent? And is it affecting your comfort, appetite, sleep, or daily life? In the next few minutes, we'll walk through the specific signs that deserve more attention, not to panic you, to help you notice what matters, because constipation can be linked to dehydration and diet, but it can also be tied to medications, thyroid issues, nerve problems, or bowel conditions. Knowing the difference is the point. Let's start with the biggest signal of all, sudden change. Moving to slide 2. One of the clearest reasons to seek medical input is a sudden change in bowel habits that doesn't make sense for you. If you were regular for years and then over a few weeks, you're consistently constipated, that shift matters. Especially if you didn't change your diet, travel routine, stress level, or activity in a big way. Clinicians take new and persistent symptoms seriously because they can point to an underlying issue that needs to be identified, not guessed. This is even more important if you're over about 50, because the list of causes changes with age. It doesn't mean something scary is happening. It means the threshold for checking is lower. Also pay attention if constipation alternates with episodes of diarrhea. That pattern can sometimes signal irritation or narrowing in the bowel. The takeaway is simple. If your baseline changed and it's sticking around, that's a reason to get it assessed, rather than just cycling through home fixes. Moving to slide 3. Pain is another major divider between routine constipation and something that needs attention. Mild cramping can happen when stool moves slowly, but severe abdominal pain, pain that keeps you from sleeping, or pain that steadily worsens is different. The same goes for a belly that becomes increasingly swollen or tight. Those signs can suggest more than simple sluggishness. They can point to significant blockage, inflammation, or other conditions that need prompt assessment. Another clue is pain paired with an inability to pass gas. Gas is usually easier to pass than stool, so if both stop, that can be more concerning. Also notice if you feel nauseated or start vomiting along with constipation. That combination can mean your digestive tract is under stress upstream. The practical rule is this. If your constipation comes with intense pain, progressive bloating, or vomiting, don't just try to push through. It's a situation where getting medical guidance quickly is the safer move. Moving to slide 4. Blood is a symptom you should never ignore, even though the cause is often treatable. Bright red blood on toilet paper can come from hemorrhoids or a small tear called a fissure, especially after hard stools. But you still want to take it seriously, because bleeding can also come from higher up in the digestive tract. Dark, tarry stools can suggest older blood that has traveled through the intestines, and blood mixed into the stool, rather than just on the surface, can be another clue that deserves evaluation. The key is pattern and amount. A single tiny streak after straining is different from repeated bleeding, clots, or bleeding with dizziness or weakness. Also, constipation plus bleeding can create a loop. Hard stool causes injury, injury causes pain, pain makes you avoid going, and constipation worsens. If bleeding is new, persistent, heavy, or paired with other red flags like weight loss or fatigue, it's time to get checked. Moving to slide 5. Unintended weight loss alongside constipation is a combination clinicians pay attention to. The reason is simple. Weight loss can signal that you're not absorbing nutrients well, not eating because you feel unwell, or that your body is dealing with a deeper problem. It's especially notable if you're not trying to lose weight and your habits haven't changed. Another related sign is loss of appetite that lasts or feeling full very quickly. Sometimes constipation makes you feel heavy and less hungry, but if it's persistent and paired with weight loss, it's worth investigating. Also consider fatigue that feels out of proportion. If you're tired, pale, or short of breath with exertion, that can sometimes connect to anemia, which can be related to bleeding in the digestive tract. None of these signs diagnose a cause by themselves, but together, they shift constipation from annoying to needs a proper workup. If you notice weight dropping without effort, don't just focus on fiber. Get evaluated. Moving to slide 6. Let's talk about fever and systemic symptoms. Constipation by itself doesn't typically cause a fever. So if you're constipated and you also have a fever, chills, or feel generally unwell, that combination can point to infection or inflammation in the abdomen. Another systemic sign is significant night sweats, or a sense that something is off in your whole body, not just your gut. These symptoms don't tell you exactly what the cause is, but they raise the stakes. They suggest this isn't just slow transit from diet or dehydration. It could involve the appendix area, diverticular disease, inflammatory bowel conditions, or other problems that need timely evaluation. Also, if you have constipation and lose severe tenderness when you press on your belly, that's another reason to get help. The main message is to look beyond the bathroom. When constipation comes with fever or whole body illness, treat it as a medical issue, not a lifestyle issue. Moving to slide 7. A very practical warning sign is constipation that doesn't respond to reasonable basic measures. If you've increased fluids, added fiber gradually, moved your body more, and given it time, you should usually see some improvement. When nothing changes for weeks, it's worth asking why. Sometimes the issue is pelvic floor dysfunction, meaning the muscles that coordinate a bowel movement aren't relaxing correctly. Sometimes it's slow transit constipation, where the colon moves sluggishly for neurological or hormonal reasons. And sometimes it's a medication effect that won't resolve until the medication plan is reviewed. Another clue is needing laxatives frequently just to function, or needing progressively stronger products. That doesn't mean you did anything wrong. It means the underlying driver might not be lack of fiber. Persistent constipation can also lead to complications like hemorrhoids, fissures, or fecal impaction. If you're stuck in a cycle for several weeks, a clinician can help sort the cause and safer next steps. Moving to slide 8. Medications are a huge, often overlooked cause of constipation, and this is one place where medical guidance can really help. Opioid pain medicines are well known for slowing the gut, but many other drugs can do it too, including certain antidepressants, iron supplements, calcium supplements, some blood pressure medications, and medications used for allergies or overactive bladder. Even if you've been on a medication for a while, dose changes or adding a second medication can shift your bowel function. The warning sign here is timing. If constipation started soon after a new prescription, a new supplement, or a dose increase, don't just assume it's random. Bring a complete list of what you take, including over-the-counter products. Clinicians can look for patterns and alternatives, or suggest strategies that fit your situation. The goal is not to stop anything on your own. It's to connect the dots safely. If your constipation is medication-linked, treating it like a mystery can keep you stuck. Moving to slide 9. There are also warning signs that point to nerve or muscle coordination problems. If you constantly feel like you can't fully empty, even when you do go, that can be a clue. So can needing to strain hard most times or spending a long time trying to pass stool with little result. Another sign is needing unusual maneuvers to help stool pass, which can happen with pelvic floor dysfunction. People sometimes describe it as, "my body won't let go," even when the urge is there. These issues are more common than most people think, and they're not about willpower. They're about coordination between the rectum, pelvic floor muscles, and nerves. The reason this matters medically is that the evaluation and solutions are different from simple constipation. Clinicians may ask about stool form, frequency, and the sensation of blockage. They may also consider tests that look at muscle function. If the main problem is emptying, not stool hardness, it's a strong reason to seek targeted help. Moving to slide 10, let's cover fecal impaction because it's common and often misunderstood. Impaction means stool becomes so hard and stuck that it can't pass normally. The warning signs can be surprising. You may have days without a real bowel movement, but you might also have leakage of liquid stool around the blockage, which can look like diarrhea. You might feel rectal pressure, a constant urge to go, or pain when sitting. Some people notice urinary problems because a full rectum can press on the bladder. Impaction is more likely in older adults, people with limited mobility, dehydration, certain medications, or neurological conditions. The reason it needs medical attention is that forcing it at home can cause injury, and leaving it can lead to worsening pain and nausea. If you suspect impaction, especially with severe discomfort, leakage, or inability to pass stool despite strong urges, contact a healthcare professional promptly. It's a fixable situation, but it's not one to ignore. Moving to slide 11. Certain groups should have a lower threshold for getting constipation checked. If you're pregnant, severe constipation can overlap with dehydration, iron supplementation, and changes in hormones and pressure in the abdomen. If you have diabetes, thyroid disease, Parkinson's, multiple sclerosis, or a history of stroke, constipation can reflect nerve or muscle changes that benefit from medical oversight. If you've had abdominal surgery, scar tissue can sometimes affect bowel movement patterns. Another important group is anyone with a personal history of colon polyps, inflammatory bowel disease, or a family history of colorectal cancer. In these situations, clinicians often want to know sooner rather than later when bowel habits change. The point isn't that constipation equals a serious diagnosis. The point is that your risk context changes how carefully symptoms should be interpreted. If you're in a higher risk group and constipation is new, persistent, or paired with pain or bleeding, it's smart to bring it up early. It can save time and worry later. Moving to slide 12. If you decide to seek care, knowing what information to bring can make the visit much more useful. Start with your baseline. How often did you normally go, and what changed? Note how long it's been going on. Track stool form in simple terms: hard pellets, large hard stools, or thin stools. Thin stools can happen for benign reasons, but if that's new and persistent, mention it. Write down any red flags you noticed, like bleeding, weight loss, fever, vomiting, or severe pain. Also list every medication and supplement and any recent changes. Clinicians may ask about hydration, fiber intake, activity, and stress, but also about pelvic floor symptoms like incomplete emptying. Depending on the situation, evaluation might include a physical exam, blood tests for anemia or thyroid function, stool tests, or imaging. Sometimes a colonoscopy is considered based on age and risk factors. The goal is to identify the driver, rule out dangerous causes, and choose the safest plan for you. Moving to slide 13. Let's end by putting the red flags into a simple decision filter you can remember. First, think change. Is this new for you and lasting more than a couple of weeks? Second, think severity. Is there severe pain, progressive bloating, vomiting, or inability to pass gas? Third, think blood and body signals. Any persistent bleeding, dark stools, fever, or unexplained weight loss moves constipation into the get checked category. Fourth, think context. Are you on constipating medications or in a higher risk group due to age, medical history, or family history? If any of those are true, it's reasonable to contact a healthcare professional and describe your symptoms clearly. And if you're ever unsure, err on the side of asking. It's what clinicians are there for. If you found this helpful, subscribe for more calm, practical health explainers, and comment with a quick yes or no. Have you ever ignored constipation longer than you should have? This information is not a substitute for medical advice. Better signals, better metabolism, better life.